Welcome to our County Health Rankings and Roadmaps webinar on policies and programs to help build a culture of health. County Health Rankings and Roadmaps is a partnership of the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. I am Attica Scott, your community coach with County Health Rankings and Roadmaps, and I'm joined today by two very special communities who are part of our national partnership, as well as some colleagues who will be helping us out on today's webinar. We have Maggie Adams, who is a program manager with Mothering Asheville, Community-Centered Health. We also have Cindy McMillan, who is a trained birth doula, Sisters Caring for Sisters, Doulas for Social Justice. Cindy and Maggie, can you say hello to the audience?
Hello, everyone.
Thank you. Welcome. And we also have Michelle Connolly, who is Executive Director of the United Way of West Central Mississippi. Michelle, can you say hello?
Hey, y'all.
Thank you so much, Michelle. We also have monitoring the chat box my colleague Justin Rivas and my colleague Allie Havrilla, and they will both be, Justin will be monitoring the chat, and then Allie will be monitoring the question box. So we're going to ask you to make sure if you have questions to put them into the question box. And then in the chat box, you'll get resources from Justin as well as our colleague Joanne Lee from Healthy Places by Design. And I'll be sharing a little bit more about Joanne's role with us that's coming up after this webinar. And then we also have tech support. If you have any questions about tech support, please be sure to put those questions into the question box. And there's James Lloyd, who's going to be helping us with tech support if you need that at all. So if you have any audio or video issues, please just be sure to let us know. So as I mentioned, we have our colleague Joanne Lee from Healthy Places by Design, who will be leading a discussion group immediately following this webinar. And the discussion groups are interactive learning experiences. It's a chance for you to really share ideas and ask deeper questions of both the presenters and yourselves. You know, share what you have that may be resources that are useful to the conversation today. And so that discussion group will be via video conference. And so in a moment, you'll see a few of us who will pop up on video, just as James just did. And if you're not able to participate via video conference, then you will have directions on how to participate via phone. And we will use a similar technology, actually the same technology that we're using today, Zoom technology. And we really want to use the opportunity for a discussion group conversation to really deepen your learning, because we know with the webinar, you get to hear from the presenters, you get to chat in questions, but we really want to make sure that with the discussion group, you get to have a more rich conversation, a robust conversation where you're able to participate as well. So our learning outcomes for today, as we talk about policies and programs to help build a culture of health, is one for you to understand what we do and why we do it. It's also an opportunity for you to hear from two of our Culture of Health Prize winning communities, and you just met three of our presenters from those two communities. And then to act on what's important using policies and programs. And so why do we do what we do? We do what we do to improve health outcomes. And I'm going to pause here just for a moment to just check in with Allie, who is supporting me on the webinar, to see, Allie, if there are any concerns or questions at this point that have come up for anyone.
It doesn't look like it, Attica, and everything's sounding and looking good on my end. So.
Awesome. Thank you so much, Allie. I appreciate you. And so folks, if you do have any questions or concerns or comments, please be sure to chat your questions directly into the question box that Allie is monitoring, and then Justin and Joanne will share in the chat box resources and tools that are going to be used during our conversation today with one another. So what we do, we work to improve health outcomes, and you have probably seen your Culture of Health snapshot. Hopefully you have. If you haven't, I'm definitely going to encourage you to check it out on our website at CountyHealthRankings.org. and you'll really get an idea of where health is in your county. And then we're available as staff here at County Health Rankings and Roadmaps to support you toward moving toward action. And so we also do what we do to increase health equity. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where they live or the circumstances that they were born into. And we know that the choices we make depend on the opportunities that we have, whether it's access to healthy foods or a quality education, or living in a safe environment and living in affordable housing and in crime-free neighborhoods. But we know that not everyone has these opportunities. These unequal opportunities that create differences in health, they don't come about on their own or because of the actions of individuals alone. They're often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. We see this in bank lending practices, for example, or school funding that's based largely on local property taxes, and policing and prison sentencing that have perpetuated discrimination. And this means that everyone does not have a fair and just opportunity to live a long and healthy life. But communities have the power to change this. Think about your own community. Who's not thriving? Who doesn't have the same opportunities for health? What barriers have been put in place over the years? What will it take to remove them and change the opportunities in your community? What opportunities do you see in your own community for closing gaps? So this is an opportunity for you to share in the chat box any of those opportunities that you see in your own community for closing gaps. It's an opportunity to share, so please be sure to chat out to all attendees so other people can see the opportunities that exist in your community for closing gaps. And if something comes up that everyone will be aware to that. So we have a poll that Justin is going to launch for us. So I'll pause here for a moment so that Justin can launch that poll. We want to make sure that you're able to be involved and engaged in this webinar.
Hey everyone, this is Justin. You should be seeing the poll on your screen, and it looks like we're getting a lot of responses rolling in, which is great. And it's fluctuating in real time, about half and half on the first two options here. And I'll wait about another 30 seconds to let you guys throw your responses in. I'm getting some chats in that, yes, we did not include the third option in the actual launch poll. I apologize for that. And if people want to maybe chat in why they think maybe number 3, launching an effective advocacy campaign is particularly a challenge for them, we could maybe share some of those thoughts and discuss that too. But I'll end the polling now. And again, I apologize for that. And I will share the results, which is very close to 50% here. That's striking, seeing that almost 75% of you answered. So maybe, Attica, we can provide a time to discuss that third option too, or we could do it right now as to why that might be challenging. And I'll watch out for chats as well. But I'll stop sharing results and hand it back to Attica.
Awesome. Thank you so much, Justin. And Justin's absolutely right. We still want to hear from you on that third question. So if you want to chat in your responses to that third question, then please do so. And I think I have to close the poll. I do. Okay. All right. All right. So if you would chat in your response to that third question, launching an effective advocacy campaign, we'd appreciate you. Thank you so much. So this may look familiar to a number of you who are on the webinar. And as I mentioned before, we talk about why we do the work that we do. And now we really want to look at the what and the how. So as I mentioned, one of our goals is to improve health outcomes. So let's look a little bit more closely at what this means. We use this key image to think about the what and the how of creating healthy communities. And so this is our rankings model. It really helps us to understand what makes or drives health in a community. So one of the goals that we have had with this image is to help change the conversation about health and what influences health. So this image shows us that health is more than what happens at the doctor's office. A wide range of factors influence health, how long and how well we live. It includes things we often think about when we hear the word health, like healthcare and how well we eat and how much we move. But we know it's also things like education and income and the quality of our housing and the safety of our neighborhoods. So how do we support communities? You know, you take a look at your health snapshot, you look at our model, and you might start wondering, okay, what can I do? Or you have an idea of what you'd like to do, and you're looking for some support. So we at County Health Rankings and Roadmaps work to support communities to bring people together to look at many factors that influence health. We select strategies with you or support you in selecting strategies that can improve health for all and close gaps, which is, you know, one of the questions that you just responded to in the poll. And we really work with you to make changes that will have a lasting impact. That's one of the reasons we're doing this webinar, looking at policies and programs. We also work to gather and share stories of communities around the country that are at different points on this journey to serve and really to serve as examples and inspiration for you and your partners. And so that's why we have our guests, Cindy and Maggie and Michelle, on the webinar with us today. So let's hear from our guests today. So we, of course, as I mentioned before, have Cindy and Maggie who are with us from Mothering Asheville and Sisters Caring for Sisters, Doulas for Social Justice. Welcome again, Cindy and Maggie.
Hello. Thank you, Attica.
You're welcome. And folks, you should be seeing us on live video right now. If you aren't seeing us, please be sure to chat that in and let us know. So I wanted to start with just asking the both of you to share the story of Mothering Asheville. And, you know, I know that you're going to share with us definitions and the model of your work. So I'll start with you, though, Maggie. And Maggie's a project manager for Mothering Asheville, and she's going to share a little bit about her work. But what I'd like to know, Maggie, is when did you begin to realize that mothering needed to be a priority in Asheville?
Yeah, so I mean, I'll start off by saying that I work for MAHEC OBGYN. MAHEC stands for Mountain Area Health Education Center, which is a part of the AHEC system in North Carolina. At MAHEC OBGYN, which is just one of the clinics within MAHEC, we also have a family health center and a dental clinic, as well as many other residency programs. For MAHEC OBGYN, mothering was always a priority. But for us, Mothering Asheville really started in 2015 when we were presented with the opportunity to really start diving into what it really meant to engage community in a different way than our clinic had ever done. That opportunity was presented to us from the Blue Cross Blue Shield of North Carolina Foundation. And it was based off the model called the CommunityCentered Health Home, which very similar to what you just presented about is a way for clinics and healthcare systems to realize that things outside the healthcare system are impacting the health of our patients and our clients. So it was a chance for us to take a step back, and instead of telling a community, here's the answer, and we have all the solutions to all the things that are going wrong with birth outcomes in certain communities, we started forming partnerships with outside organizations like our legal aid, with local children advocacy groups, with our local YWCA, and about 15 other organizations in our community to really think about how do we start building authentic relationships in a different way, and how do we go to community and instead of present what our ideas are, take a chance to sit back and listen.
Thank you, Maggie. That's so helpful. And I really appreciate you bringing up the point about authentic community engagement and how important that is, listening to folks, listening to residents, and listening to what is their agenda, what's their concern, rather than coming in with your own. So thank you for that. So Cindy, can you share with us about Sisters Caring for Sisters, Doulas for Social Justice, and in particular, can you share with folks what a doula is and what a doula does?
I sure can. Sisters Caring for Sisters is quite a unique story. We were started around a picnic table, believe it or not, in one of the communities here in Asheville. Maggie and other groups of community leaders, they would come over and just get to know us one-on-one. We didn't have an agenda. We didn't really have a purpose. We would just sit around and conversate and talk about the needs within the community that we saw. And eventually that turned into us going to, a lot of the ladies going to a conference to hear Dr. Arthur James speak about the infant mortality rate, and particularly here in Buncombe County, it was extremely high. And we sat around this table and we sat around each other, the women in the community, and we was trying to figure out ways that we can help our community and what things that we could do from where we were at. And luckily, it was like fate. One of the ladies came to the picnic table. At the time, we didn't know she had her own doula service company, and she offered to teach us a skill. She said, I have a skill that I would like to teach you guys if you are willing to learn. And we didn't have any idea what a doula was. It was just like crazy. We didn't know, but we all voluntarily said, yes, we want to take this training. And when we found out, it was amazing because it just took off from there. We started supporting women within our community, doing doula work, supporting them in different ways that was because a doula provides evidence-based informational support. We provide emotional support. We provide physical support to our women. But on top of that, we go a little bit extra because we provide after-hours support, resource support. We provide our moms in a non-judgmental environment, in healthy spaces, so they're able to talk. And all that has transformed to that picnic table. Now we have not only the doula, the women that's doulaing, we have a mother-to-mother group with a lot of different women from different communities that meet up once a month.
Awesome. Thank you, Cindy. I feel like I understand what it means to be a doula a little bit better now. So I appreciate you sharing that. So Maggie, we're talking about doulas, which is connected to mothering. So can you share with us the Mothering Asheville model?
Yeah, thanks, Attica. So for us, I think we had no idea originally that we were going to enter the world of doulas. I think that it was something that came really naturally, like Cindy was talking about, through that authentic community engagement. And through our local partners that already had established relationship and trust. For instance, our local Children First communities and schools that had a resource center in one of the communities that we were meeting in. So we were able to build off already existing relationships. And when the ladies went through the doula training, we weren't really sure what was going to happen after that. And at that point, that's really where we look at how the community-centered health home works. And so the community-centered health home is a model designed by the Prevention Institute. And to us, it really means that in order to make true population community health outcomes change, you need to do three things simultaneously. You need to be making a clinical shift. You need to be building community capacity, and you also need to be impacting the environment and policies that are prohibiting from those first two sectors being successful. And so for us, really, we started with the community capacity building. So we spent over a year just sitting around a picnic table, developing relationships, building trust, saying that we weren't just going to come in and leave as soon as grant funding was over. And through that, when the ladies developed their organization and said, this is what we want to do, and this is what we think will actually impact our community most, our clinic made a policy change. At that point, our clinic, for the first time in its history, brought on our first lay health workers as employees. So at this point, we were not only helping to build community capacity, but we also then were giving economic opportunity. So the women that are the doulas that started off with us at that picnic table are now getting paid by our organization to do this work. And it's work that they set up for, that we are shifting our clinic to. Not that the clinic is, not that we're expecting them to shift to our individual needs. And it's really impacting the way that we're seeing things. And a lot of that understanding also comes in the form of understanding what other policies and procedures we have within our clinic that are prohibiting women from getting the best care. And a lot of what we've heard and a lot of what we learned through our listening is that because of racial inequities and because of racism in our community, that's why we're seeing such a high disparity between Black and white baby infant outcomes. And so we're also able to build into our curriculum that our staff members need to be trained on the history and the impact of racism within the United States and how it shows up in healthcare and the way that we provide healthcare today. Through that, we have also partnered with one of a local policy agenda group called the Success Equation, which was a group that was working on policy within our community that already existed. It wasn't something that we needed to create that was new. It was something that already existed. So we were able to leverage those partnerships and start building into our residency programs, our family medicine residency and our OBGYN residency, didactics on local policy around the social determinants of health that were impacting community, whether that be housing or transportation or childcare. And so now that is a part of our resident didactics, is that they're learning locally what policies are impacting and how they might be able to show up in that space.
Wow, Maggie, thank you. So you're describing community-centered health really goes to this idea of policies being, internal and external, that policies aren't only what's happening at the federal, state, or local governmental level, but also what's happening internally. So I really appreciate you for sharing that. And I imagine that some folks will probably want to dig a little bit deeper into that with you. Cindy, I'd love to close with you sharing this amazing vision of Mothering Asheville. It's a powerful vision that may resonate for some of the viewers.
All right. Well, Mothering Asheville's vision is by 2027, we plan to eliminate disparities in infant mortality in Buncombe County, changing the current 2015 data indicating that African American babies die at 3.1 times the rate of white babies. To drive and sustain this change, we will engage community members and organizations and healthcare providers and administrators to advocate for institutional policies that address institutional racism, implicit bias, access to care, and social determinants of health. In collaboration with community leaders, we will promote increased access to preventative services in community-based settings, particularly for African American women of childbearing age, and create systematic change in the way that women in Asheville access care.
Wow, thank you. Thank you both so much. Appreciate you, Cindy and Maggie.
Thank you.
You're welcome. I'm just going to pause quickly and check in with Allie to see if there was something that rose to the top for her for questions that might want to be addressed right now.
Yeah, thanks, Attica. Cindy and Maggie, I'm wondering if you could, as we think about the definition of doula, describe how they are similar and different maybe from midwives and community health workers. A question came in asking if they were the same, were they different? So I just thought now might be a good time to provide a little clarity around that.
Yeah, no problem. With a doula does not provide any clinical, like medical exams. We don't do any vaginal exams. We don't perform any type of care outside of the support. We don't do blood pressure. We don't do heart tones. We don't do anything that a midwife does. But here in Buncombe County, we are allowed to support and be with that mom while she's having, no matter her birth experience, whether it's in the delivery room or the operating room. We have access. We're considered as staff. We're there through the whole process. We're there from the beginning of the time she hires a doula usually around 30, 32 weeks, sometimes sooner. And we're with that mom until she delivers and beyond. Every one of our doulas here in Asheville that work here with Sisters Caring for Sisters, we're all breastfeeding peer counselors and childbirth educators. So we have taken it like to a whole nother level. But as far as being like a midwife, no, we're total opposite. We don't provide any medical care or medical treatment.
Thank you so much, Cindy.
Yeah, and in terms of the community health worker, doula is kind of a very specialized community health worker. There's a lot of different models out there that have done this already and have done an amazing job. I think one organization that we dream of one day being as amazing as is Mama Toto Village in Washington, D.C. And they've really created a really awesome model. I would encourage you to go check it out. And it really goes from doula to a perinatal community health worker. So a doula, and they are really doing a lot of the things that community health workers do and accessing, because of their relationships with our local legal aid organization, they're able to say, hey, we trust this lawyer, you can go talk to them. We trust these people. So there is still a lot of similarities, but it's just much more specialized.
Yeah, I think it's more specialized too, because we have continuous care. We're with you through that whole process. Whereas a nurse and a midwife and a doctor, healthcare provider are leaving the room when you're in labor. We're there with you through the whole thing. We don't leave that room. We're with you, we're supporting you through it.
Awesome. Thank you. And Maggie, if you get a chance while Michelle is presenting, can you share out a link to that DC-based group for folks?
Absolutely.
Thank you so much. Thank you both. And thank you, Allie, for that question. I know that you've got others, but we'll hold those until after Michelle's presentation. So I want to welcome Michelle Connolly. And Cindy and Maggie were from our Cultural Health Prize winning community in Buncombe County, North Carolina. And Michelle is from our prize winning community in Vicksburg, Mississippi. So welcome, Michelle. And what I'd like to start out hearing from you is, what difference has winning the Culture of Health Prize meant for Vicksburg, Mississippi?
It's really re-energized us, Attica. It's given us more gusto to keep moving forward. It has brought to everyone's attention how proud we are of the partnerships that we've made along the journey that we have taken to build a strong culture of health.
Awesome. Thank you. So what we know is that Vicksburg didn't win the Culture of Health Prize the first time that you applied, and that's okay. So what did you learn from not winning the prize when you first applied?
We were very blessed because the Robert Wood Johnson Foundation came back to us and told us what were some things that we needed to look at, what were some things that we needed to address in our journey towards building that strong culture of health in our community. There were three things that they brought to our attention. It was definitely committing to sustainable systems change, which is what we're talking about today. At that time, events, programs, Band-Aids, all of those things are very much so needed in each community, but what were going to be our policy-oriented long-term solutions? What were we going to do towards the future? The second one was securing and making the most of our available resources. Now, I must tell you, in Vicksburg, Mississippi, we truly feel as if we take advantage of absolutely every resource that we have, but it's how do we share with others those resources that I think was something that we needed to look within and figure out. And then the third was measuring and sharing progress and results. We were doing a lot of measurements, but we were more or less doing more demographic data or capacity building data, or collecting all of that. How many people were showing up to a run? How many people were coming to the clinic? How many children were enrolled in the summer program? It really wasn't talking about what work was being done and what were we accomplishing with the programs once the children or the individuals arrived. The data that everybody was wanting to see and to feel and to touch, we weren't actually providing. We were just telling them how many people showed up.
Thank you so much, Michelle, for sharing that, because it's important for people to know that there can be victory even if you don't win the prize the first time. So what happened next?
Well, the Robert Wood Johnson Foundation, as you know, Attica, suggested that we partner with the Roadmaps to Health Action Award, and we did. And we received the most fabulous coach that anyone could receive, Miss Attica Scott. And Attica did a great job of coaching us and teaching us what we needed to do as a community to work towards that stronger culture of health. I can tell you it was a very pivotal moment in both my personal and professional life because this coaching opportunity brought together some very important people in our community. We had myself with the United Way. We had the executive director of Shape Up Mississippi. We had the city of Vicksburg's former leader in our grants department. We had the executive director of the Vicksburg Warren Chamber of Commerce. We had Alcorn State University, Triumph Church, and the Vicksburg Warren School District, all coming to a very important decision to come around the table with one common goal, and that was to figure out how we could continue strengthening our culture of health.
Awesome. Thank you, Michelle. So then, what'd you do to win the prize?
Well, so in 2017, when we were named a Culture of Health Prize winning community, we were able to celebrate several things. We were able to celebrate our downtown revitalization. 5 years ago, our vacancy rate in downtown, the historic downtown area, was 65%. It was pretty dead. Now, today, it's only 4% vacant. With more restaurants, museums, retail, residential, and tourists coming in every day. We use tax credits and other incentives to attract new businesses, and we've seen a drastic change in our vacancy rate in the downtown area. What was once a ghost town is now very vibrant, which is very positive for our community. But on a Friday evening, when you're looking for that parking space for that wonderful restaurant, you have to fight over it. So that it does bring a challenge with it also. I encourage everyone to come and visit Vicksburg and just see our downtown area and our wonderful community. Exactly like the other community, we had to realize the importance of community listening sessions. And I must say the mayor of our community really believed in that. He formed community listening sessions where individuals their focus was to go into segments of our community and listen, not to talk, not to tell them anything, but just to listen and to gather that important information that he needed and that our supervisors needed in order to make important decisions. Some of those decisions were the improvement of our neighborhood parks because we needed safe places for our children and our families to play and to feel safe. And also we brought in a new sports complex that not only gave our children top-notch opportunity to go and compete against each other and with each other, but it also brought in some more economics to our community, which was extremely fortunate for us. We also were making the best of our resources, and like I told you earlier, I think we were doing that. We just really needed to know how to share that we use much more than just the money and consider that resources also. And then we created an economic vision. This was big for our community. We had 3 separate entities that looked at economic growth in our community. We had a Chamber of Commerce, we had an Economic Development Committee or Foundation, and we had the Port Commission, all 3 of them working separately with each other. Well, we recently hired one person to look over all of those entities, and we now call that the Alliance, and since then, we've had 3 major industries come to our community with hundreds of jobs that are open and available for our community. The last one that I do want to make reference to is our increased graduation rate, because for me as a previous educator, this is what I am the most proud about. We currently have a superintendent who definitely thinks outside of the box, and he has changed the fabric of education in our community, changed it so much that our graduation rate in the past 6 years has increased by 10.8%. In 2013, we only had 59.8% of our young adults graduating from high school. And last year we celebrated 70.6 graduating. So that is a huge accomplishment for our community. But we also know 70.6 is below the state average and the national average, so there's still much work to be done.
And that's a good point. There's always work to be done, even in prize-winning communities. But you have some great data here. So how did you use this data as you were moving toward building a culture of health?
As I had mentioned earlier, there were so many people around the table, and all of us had wonderful focus areas. Collectively as a group, we focused on diet and exercise. But during the coaching opportunity and looking at the data and trying to decide where we want it to go and how we want it to move forward, for me as the executive director of the United Way of West Central Mississippi, I thought it would be very important to look at that graduation rate. Yes, we'd seen improvements. Yes, we had momentum building so that we could continue increasing this graduation rate, but I really felt as if we needed to continue working on. And knowing this as a community as a whole, I really think that it drives what we are doing. So with that being said, what did we do with data? Well, the United Way of West Central Mississippi looked at that high school graduation rate. That is definitely one that drives what we are doing. But then there's some other external data points that we had to look at also. External data points that really build upon the high school graduation rate, such as our third grade reading assessment. What was that looking like? Were our children learning how to read before they reached the third grade so that they could then read and learn after that? What was our kindergarten readiness scores looking like? Are our children prepared to get into kindergarten and be successful in all that they do? Both of those are very foundational and critical moments during a person's learning journey. We know that. We all know that's common sense. We know that the children need to be ready for kindergarten, and we know that they need to be ready to read by third grade, and we know how important both of those are for high school graduation. But we needed to understand the importance of the data so that we could take action, so that we know where to take the action, when to take the action, how to take the action, and how to course correct along the journey. So for instance, we know that our third grade reading assessment scores needed improvement in Vicksburg-Warren School District and across our county and city. We know that out-of-time school is very important also, such as after-school programming and summer programming. And for years, we had fabulous after-school programming and summer programming, but we were missing one very important piece to this. We were working alongside the school district instead of working with the school district. And because of the strong relationship that we have built with the Vicksburg-Warren School District, and because of their ability to think outside of the box, we have now formed a new partnership that is definitely data-driven. We're very fortunate that our school board created a legal document and approved a legal document so that parents could grant permission to the after-school program to gain access to their cumulative records. And when they gained access to their cumulative records, they actually saw what the children were successful with and where their challenges were, and what benchmarks were they not meeting, and what grade levels were they performing in each one of those benchmarks. So with that being said, the Vicksburg-Warren School District also assisted us in creating individualized lesson plans for children who were enrolled in our after-school programming. There are 50 at-risk students who are currently receiving one-on-one tutoring/mentoring in our after-school programming, working on the benchmarks, not the homework, not the tests and the quizzes, but the benchmarks that these children need to master before they are moving forward. It's very difficult for a sixth grader to work on sixth grade material if they have not yet mastered third grade material. And knowing that and being respectful of the growth of that child, being able to build that relationship and work with them has been outstanding. Our school district has also agreed that we can continue to access the data. The students already take an iReady assessment 3 times a year, and we will have access to that iReady assessment so that we can see the growth and course correct and recreate lesson plans for these children so that they are able to continue filling the gap that so desperately needs to be filled. Now, I must tell you, along this journey, knowing the external data points is extremely important. Knowing your high school graduation rate, and then drilling down to third grade assessment, reading assessments, and kindergarten readiness is important. But I really think what is the most important is to recognize that these large percentages that drive the work that we do, they comprise of children in our school district. And we really need to make sure that we keep that in mind, especially when we're working on sustainable system change. We need to recognize that the percentages that we're looking at on the screen are made up by children, their parents, the mentors, the teachers, and everyone who has taken a part in their lives. So when we are making decisions, we're making it based on the whole child, not just part of the child.
Wow. Thank you so much, Michelle, and thank you for making the connections between data, policies, programs, and how they drive one another and support one another. So appreciate you for that. Allie, I want to check in with you to see if there's a question that's risen to the top for you for Michelle before we kind of build on Michelle's point around action.
Yeah, thanks, Attica. Michelle, thinking back to your previous slide, could you share a couple of examples about how you guys demonstrated making the most of available resources?
Making the most of available resources, most definitely, I would love to share that. Like I said previously, I really think that we were making the most of available resources. We just didn't necessarily know how to share that. We always have to remember that the first thing that we think of when we say resources is money. How are we using the money that we have? And for us, and I don't know about everybody else, but sometimes money is difficult to get and difficult to be able to maintain in communities, especially in the nonprofit world. So I think we need to think outside of the box more on what resources are. Resources are collaboration. Resources are people. Resources can be in-kind donations. Resources can just be the passion and the love that other people bring to the table. It can be the hard work. It can be the blood, sweat, and tears. It could be anything and everything, in my opinion, that drives forward what you want to accomplish in your community. One of the things that I'm very proud to say is so very often we drive forward with, even if we do not have the monetary resources that we need, because the more you drive forward and the more people you bring around the table and the more blood, sweat, and tears that you pour into something, people begin to then recognize, and the money sometimes, most of the time, follows with it.
Thank you, Michelle. Appreciate you responding to that question. And I know we've got other questions that we'll get to in a moment, but you talked about action. Cindy and Maggie talked about action. So Allie, I wanted to share with folks that we have an action center that could support them if they're thinking about how they can use data to drive policy and program work in their community. So you'll find our Action Center under Take Action to Improve Health on our website, and it provides step-by-step guidance and tools to help you move with data to action. And it answers questions like, how can we take action? And each step is broken down into key activities with guidance and suggested tools to support your work. So Allie, I'm curious to know, and I think that it might be helpful for our viewers to know how they can get the most out of the Action Center.
Yeah, thanks, Attica. And I think Michelle summed up so perfectly when she was talking about the need to think about, how do you see your efforts moving forward in community? And so the Action Center can be a destination to help you explore that. And so when you visit the Action Center, you can think about, are you assessing your needs and resources, or are you looking to choose effective policies and programs? And so thinking about those questions can be helpful. You might also visit the Action Center when you're feeling a little stuck. Perhaps you're having trouble working with your partnership to move from assessing and planning to actually implementing the policy changes or programs you've selected. And if that's the case, then the Act on What's Important step can help. Or maybe you're struggling to keep your partners engaged or struggling to recruit diverse stakeholders to your efforts. And that's where the Work Together guide could really be useful in some of the resources within the guide. And so what we recommend is click on the guide that seems most useful to you and review the related key activities. And then explore one of those key activities that resonates with you. I think one of the things that I like to remember is that although this is a landing page within the County Health Rankings and Roadmaps website, it's set up to be a just-in-time resource that you can revisit and find the right resource when you need it. So you might consider setting up the Action Center as a favorite in your browser so you can come back often.
Great. Thank you so much, Allie. And we're going to share in a moment a quick resource that might be helpful for folks, especially thinking about policies and programs. And it's in What Works for Health, Social and Economic Opportunities to Improve Health for All. And so we'll share a little bit more about that in a moment, and we'll ask Justin if he'll chat a link to that resource for you. But we're going to turn to our Partner Center in a minute and hear a little bit more from Allie about the Partner Center. But you can use it, please feel welcome to use the chat to share which steps in the Action Center might be a challenge for you right now, because that will be helpful for us to think about how best to support you moving forward. So what kind of guidance, Allie, can folks find in the Partner Center?
Yeah, and I think our guests today have done such a great job highlighting the importance of partnership. And the Partner Center really helps illustrate that we all have a role to play in creating healthier communities. And by working together, we can achieve more than working alone. So you also find the Partner Center under Take Action to Improve Health on our website. And it's all about joining with others to make lasting change in your community. So the question that the Partner Center answers is, who should we work with? And think about the people in your community who make positive changes happen. You might refer to them as leaders, change makers, stakeholders, residents. Whoever these folks are, these are the people that you want to partner with. And so then maybe think about, how do you reach them? And so you might start by doing some research to find out what their goals are and how they might align with yours. Then you might think about what's in it for them. Why would they want to be a part of your work? And then find a way to get connected and begin to cultivate relationships. And the Partner Center is a place that can help you get started. It provides guidance around why different sectors might care about creating a healthy community, what they can do, and how you can engage them. So again, this is another living resource that we encourage folks to come back to just in time to find the guidance and support they need for their journey.
Awesome. Thank you so much, Allie. Appreciate you for that. And as I promised, we were going to share an additional resource with you, and it's in What Works. It's the Social and Economic Opportunities to Improve Health for All. So in this tool, which there's a link to our website, or at least the website link is on the screen, but I believe Justin's also sharing that with you. You can go here and find specific strategies that can improve social and economic opportunities and health for all. It's one of our newer resources. You could look at how likely to reduce unfair differences in health outcomes are emphasized. So please check out the resources that we have on our website and see which ones really resonate for you and the work that you're doing in community. And so if you are looking for some support, we have wonderful coaches like Allie. Thank you so much, Allie. Appreciate you. Who are available to help you strengthen your community efforts, provide online guidance and virtual learning opportunities. So you can connect with any of us via the Connect button on any of our web pages. And you can always find the Contact Us button at the bottom of our website. It doesn't matter where you are on the website. Our team will be back in touch with you with your questions and support you in trying to find what tools might work best for you in your community-based work. We have some key takeaways from today's webinar before we dig into some of the questions that y'all have. The Action Center answers the question, how can we take action? The Partner Center answers the question, who should we work with? And then, of course, our coaches are here to help you connect with any of the resources that we talked about today. So I want to pause here and go back to Allie and see, Allie, if there are any questions that have come up for Cindy or Maggie or Michelle from our audience members.
Yeah, great. Thanks, Attica. So I would encourage folks to chat in their questions using the Q&A box as we spend a couple of minutes reflecting. And Maggie and Cindy, I might start with you and asking, thinking back to when the initiative was just starting out, those early picnic table days, share more about how you started to make connections with one another and within community.
Well, we had partnerships with, it was another organization called Children's First. And then I think they invited you guys to come to the picnic table. And then we had a couple more different, a variety of different people that would come, and we would just have like open discussions about not necessarily the work that each one did, but it was actually about getting to know one another.
Yeah, I think really the idea behind it was that it was authentic. So a lot of the times we hear about giant sessions where people can speak, and those sessions work as well. But for us, this was about building trust and relationships, which has been the most integral part of the work that we've done. So we were able to partner with organizations that already had trust with certain community members that were interested in coming. And then we didn't say, hey, you have to keep coming. We said, this is what we want to do. Are you interested in doing it? And one of the other really important things that we did is that through, because we had this grant from Blue Cross Blue Shield, we paid community members for their time. Just like you and I or anyone else can show up and we get paid for the work and input that we bring to conversation and discussion around health, we make sure that community members also have that. And then through word of mouth, it just really grew. From the beginning, we had 3 to 5 people on a regular basis. And now 3.5 years later, we have about 20 people that are coming on a regular basis that are interested in learning and are planning community events that are planned by community, that invite community partners instead of having community partners come and try to present their ideas or their approaches, but really having everything community centered.
I think that was one of the biggest things, that they didn't come in and tell us that we were going to do this and they were going to do that. They kind of left it in our hands what we wanted and what we saw and within our community that we could benefit from. And I know one of the biggest events that came to mind was we had a spa day for all the women. We was talking about all the women, how it was so stressful for a lot of the women with all the kids and never having a break and always, running and going, that how important self-care was. And we threw a big old spa day event for the whole community of women and their children, and it was beautiful. So, and we got everybody together. We had acupuncturists, we had massage masseuse, we had gift baskets from Bath Body Works. I mean, it was just beautiful.
Yeah, thanks. What really stood out for me in that, Maggie and Cindy, was sort of the authentic trusting and listening to one another to then think about how you could work together. So that's awesome. Thank you. Michelle, I'm wondering if you might be able, switching gears just a little bit, to discuss how you advanced programs and policy agenda while maintaining partnerships. How did you balance what at times might have been competing priorities, or just how did you balance that?
I would like to agree with Cindy and Maggie on exactly what they just said. Once you build an authentic relationship where you truly know that the people around the table are working towards a common mission and they're really leaving their egos checked at the front door, and that we're really working for the betterment of the people who are us. When you are working side by side with neighbors and building those relationships, when you go forward and take the next step to talk to school boards or to talk to elected officials, you're going more than just yourself. You're going and you're representing as a community as a whole. And along that journey, I would hope that you would have had the elected officials a part of that journey. So if there are listening sessions, bring them into the listening sessions and tell them, we are here just to listen, so that they can get a good temperature check of what the community needs actually are, so that when it is time to make sustainable policy changes, you are doing that because of the authentic relationships that you have made along the way. Is that easy every time? No, it's not easy every time. But do you keep trying and keep trying? Absolutely. You bring people to the table whom you know want to move the common mission, but you also bring the people to the table that have the gifts and talents in order to move forward in a sustainable way.
Thanks, Michelle. And I love that assets-based approach, tapping into talents and strengths to capitalize on what everybody is bringing to the conversation.
Absolutely.
So we've got time for one more question, and we are running a little tight on time. So I would just ask Michelle, Maggie, and Cindy to share just a couple of sentences, although I'm sure that you could share perhaps a whole webinar on this question. But really, how are you measuring success, and what indicators or tools are you using to help measure and track success?
For the program that I was speaking of, where we are doing the after-school programming, with our partnership from the Vicksburg Warren School District, I had referenced the fact that the children were taking an iReady assessment 3 times a year already, and having access to that data, we are able to track the success of our program and course correct if we need to course correct. It was not us going out there and finding a tool that we had to invest in order to track ourselves. It was finding that partner that already had it established and who was willing to share that information with us, so that we could measure our success and course correct as needed.
Yeah, and for us, again, everything for us is very community centered. In Buncombe County for the most part, a lot of nonprofits and healthcare organizations in this area have taken on their results-based accountability method for evaluating. And so we have technical assistance through the North Carolina Center for Health and Wellness, as well as through our local county health department, that have helped us to develop what we're tracking in terms of data and outcomes as an entire collective. For instance, the vision that you saw was created through using all 15 of our organizational partners as well as community members. And we did the same thing in addressing our performance metrics. So when we applied for the grant, every performance metric that we chose to follow through with was something that we had collaboratively decided upon. And it was something that was obtainable and also something that was realizable for us. And you could also see in our vision, we don't plan that anything's going to change in the next 2 years, in the next 3 years. We made our vision within 10 years to understand infant mortality. There has to be true policy and so much change that goes into actually changing that number. So that's really how we've been able to track what is most useful for us, in both with the doulas as well as our work around policy and clinical shift.
Thank you so much, Cindy and Maggie and Michelle and Allie, for facilitating that Q&A. I know there are lots of other questions, but hopefully folks will come over to the discussion group and be able to get those questions answered over in the discussion group. So we wanted to make sure before we go, we've got a couple of minutes, that you're aware of our next webinar and learning opportunity. We're excited. The rankings will be released on March 19th. And so we have an upcoming webinar on February 26th on making the most of the 2019 County Health Rankings release. And so I know that Justin's going to chat that link out to the webinars for you in the chat box. So please mark your calendar for February 26th for that webinar. A reminder that we do have the discussion group coming up with our partner, Joanne Lee from Healthy Places by Design. And we want you to make sure that you check the chat box for a link to that discussion group. Space is limited, so we want you to, as soon as we log off of here, log on to there. And I know Justin has a poll question he was going to launch for you so that we can have an idea of what you might want to dig a little bit deeper into during the discussion group.
Thanks, Attica. I launched the second poll here, so if you guys want to just start entering your answers, that'd be great. And while you're doing so, I want to apologize for what we call fire hosing you with lots of different resources here in the chat box. So there's bombarding you with really great stuff, but we're going to provide a handout of these PDFs of these slides from today's webinar and also some of these resources after the fact, as long as you were registered formally, which you are if you're here today. And then you'll have this available to you as well, so you don't have to worry about capturing all that information. But back to the poll, and I know we're coming really close up on time here. It looks like we have almost half of you have entered responses, and it looks like the majority are really interested in the third kind of option here of what could a community listening session look like in your own area. So maybe that kind of local application. So I'll stop the polling and I'll share results quickly just so everyone can see. So maybe that might be a good topic to really touch on during the discussion group today.
Awesome. Thank you so much, Justin. We appreciate you for that. All right, folks. Thank you so much for being a part of today's webinar. You can stay connected with us on Facebook, Twitter, and sign up for our e-newsletter. I know that's one more resource that Justin's going to chat out for you, so you can subscribe to that. And we want you to make sure to be on the lookout via email for a feedback survey for us so that we can make sure that we're providing you with the webinars that you need throughout the year. Again, thank you all so much, and we'll see you in the discussion group.